Well, the first few weeks as president and CEO have been very exciting. We've been doing a lot of meetings with staff and physician groups. I'm most excited about beginning our strategic planning process. So a very important prelude to that formal process are some informal discussions with different staff groups, including physicians, to really understand what's on their minds about what they would like to do differently, what we'd like to look like in 3 to 5 years, and some of the wonderful ideas that they have. And it's been very gratifying to hear their thoughts and their ideas, and clearly they've been thinking about it. Many people have asked me what drew me to this position, and there are many appealing qualities about our health system that any CEO would be proud to serve under. But the number one drawing force for me was the exceptional team of employees that we have at Freeman. Their passion, their dedication, and their commitment is unparalleled. So I'm very, very proud to serve as President and CEO of such an exceptional group of individuals. My vision for Freeman Health System is a very expansive vision. I think that we need to have a courageous vision going forward. We have every strategic advantage. We have the best and most talented team of employees. So the sky's the limit for Freeman. And I think the number one thing that we will all strive for is to sustain a culture of excellence where every patient that comes through our door and every family member receives world-class care every time. And that the name Freeman will be equated with service excellence. Freeman's success has long been built on a reputation of listening to our patients, listening to the community, and knowing what those needs are. And we are going to continue to do that in earnest. We want to hear what the community sees as priorities for our health system, and we're going to strive to meet those needs. We're very proud that Freeman is the only community-owned, locally governed, not-for-profit hospital and health system in this area. And that's very important because it means that when we make a decision, we make it for the benefit of our community and our patients. Sometimes health systems that have a broader corporate structure may have to make a decision that's best for St. Louis, but it might not be for their local community. So I'm very proud of the fact that we're community focused and driven. We have a lot of exciting projects underway right now. Obviously, with the tornado on May 22nd, our capacity needs enlarged overnight. So we're very quick to meet the needs of our community and immediately began some of those efforts. We will be opening the 5th and 6th floors soon. The 5th floor will open in April with 29 private beds, and then in September we'll open the 6th floor of the tower with 29 additional private beds. So that's going to go a long ways to help the capacity need in our community. We also will be unveiling next month a state-of-the-art sports and rehabilitation center on 32nd Street. This will have state-of-the-art equipment, and we will be able to employ some of the latest techniques and strategies in helping people recover from surgeries, from injuries, and help athletes who are in the retraining process get back into the game as quickly as possible. So we're very excited about that. We also are thrilled that we will be redoing our kitchen and our dining areas, and next fall that will open. It will allow us to have a much larger area for both preparation and serving, as well as visitors and family members to dine within, and will let us do some of the things we've wanted to do for a very long time, like room service for our patients. Ozark Center, our behavioral health division, was really the hardest hit by the tornado, and as a result, they really had to do a lot of rethinking about their facilities, and we've had some exciting developments in that regard. We were thrilled that Bill and Virginia Leffen gave a $3 million gift for the creation of a new Ozark Center for Autism. It will be named the Bill and Virginia Leffen Center for Autism. Our Autism Center was destroyed completely the night of the tornado, so this is a very exciting new chapter for us going forward. New Directions, which is our subsidies facility, will open its new facility on January the 30th, and this will give us a lot more square footage and a lot more capacity to provide services to that population. Again, that facility was completely destroyed in the tornado. And another very exciting thing for Ozark Center was the opening of Will's Place, which is a trauma center for children and adolescents. And this facility was dedicated in honor of Will Norton, who was killed in a tornado, but will be an outreach to children everywhere who are suffering any sort of trauma. So we had the dedication for that a while back, and we're already seeing patients in that facility and families and children, and it's going to be a wonderful step forward for the health system. Freeman has such a bright future. There's so much to look forward to, but we're already engaged in our strategic planning process, in which we'll be identifying some new service development that we'll be commencing with. We'll continue our quest to be the employer of choice. We want Freeman Health System to be the place where everyone wants to come to work and to receive the care that they need. So we'll be working very hard as a team to ensure that that culture of excellence remains at the very top.